I have almost always wanted to be a physician. When I was really young, I wanted to be a veterinarian, but then I figured taking care of people would be better. My mother was a nurse, so I was exposed to medicine and being in the hospital frequently. And then at some point, decided to pursue pediatrics because I also found myself very interested in children. I like to spend time with children and enjoyed that a lot. So pediatrics is where I landed. When I was in undergraduate school, I volunteered to work actually at Arkansas Children's and was stationed in one of their playrooms at the hospital. At that time, the playroom that I worked in was very near the oncology unit, and so a lot of the patients that I interacted with were from the hematology oncology unit, and I was fascinated by their strength and courage and resilience, and I knew even before being in medical school that those were probably some of the most sick patients in the hospital, but they always wanted to come and have fun. So I was really kind of attracted to that, and then throughout medical school and residency training, it just kind of solidified that decision as I rotated through the hematology oncology department. My partner and I see patients or children who have cancer of all types. We take care of patients that have blood cancers like leukemia or lymphoma, and we also take care of patients that have solid malignancies like bone tumors or kidney tumors. And then we also do hematology, which means we take care of children that have blood problems, things like anemia or platelet problems. When I walk into the room as the provider, I try to put myself in the shoes of the parent in that room and ask myself, how would I want to be approached and how I would want to be spoken to and how I would want my child to be spoken to and interacted with. I think the biggest lesson I learn each day from my patients is the power of resiliency. I see these very sick children who every day are faced with insurmountable challenges, but are still able to find the strength to laugh and to play and to have hope and to care for others. I think that they have taught me that medicine is not just about curing disease or the treatments that we provide, but about walking with the patients and the families through some of their most vulnerable times with compassion and with empathy.